Any clinician who's contemplating getting an AI scribe, like I strongly encourage them to do their due diligence in terms of all the, claimed advantages that one AI scribe has. And I strongly encourage them to try multiple vendors, right? And do direct comparison, see how it works, see if it aligns with their preferred, structure and preferences of how the tool operates and how it's can be implemented into their existing clinical operations, right? That's sort of like critical for any tool that is procured by a clinic and clinician. Um, I think what's more and more going to become an important conversation. Thanks for having me on. It's a real journey that I've been on that has resulted into where we're at with Mutuo Health. When AutoScribe was first conceived, this was way back, like we were one of the basically the first in Canada that was starting to think about this. And to your point, it was really to solve a pain point that me and my colleagues were experiencing, which was the pain of administrative work overload, and a big portion of that was note taking. And I'm a junior doctor at the time, and realizing I'm gonna have a whole career of this. There's got to be a better way, and we were starting to see in sort of like the consumer world the power of AI for understanding language and being able to parse it and generate sort of synthesized outputs from it. So that's how the project started, where before the GPT era,
Yeah.
we partnered with the Vector Institute here in Toronto, which is one of Canada's leading AI institutes, and the computer scientists that work there to come up with a proof of concept that we can create medical notes just from understanding doctor-patient dialogues. And so that, was way back in 2018, and we refined the AI model. Then GPT came out, so we had to sort of swap in GPT type models at the time. But the good thing is that we've been laser focused on integrating this into a real world workflow. So we had all the privacy security sort of analyses done at the time.
Yeah.
We really focused on the customization that's really required for doctors to use it, because every doctor writes their note differently.
Yeah.
And so, yeah, so we launched, and as a result of our being ready to capture the market momentum of all the AI scribes coming online, we became one of Canada's leading AI scribe vendors.
Okay. Interesting. Because you mentioned 2018, right? So way, way before the hype and, anyone even knowing about, well, not knowing about AI, but talking about it, right? So that's always just an interesting, tidbit to look at there. Did you have physicians or anyone using your product at the time in 2019 before COVID, at least? Did you have a beta version that physicians could try at the time?
So at the time, our accuracy of our sort of bespoke model that we created was in the range of 50 to 80%, which is actually pretty good for the time.
Yeah.
So our model at the time was having a human scribe in the loop, where basically the AI generated its output, our human scribe staff would edit that output, and then the doctor would see it. So we had some pilot users on that model starting in 2021
Yeah.
into early 2022. Um, and the problem with that is that obviously the human scribe editing took time, right? So
Yeah.
for doctors who are okay with getting their notes at the end of a clinic, it worked well. But for the
Yeah.
doctors who wanted their note immediately,
Yeah.
it didn't work so well. So it was an interesting time. The business model was a bit tricky as well because we had to like fund that human resourcing.
Yeah.
So we were certainly we were able to stand out. We were very unique in the market, but it was still early days.
Okay.
Then GPT 2 and 3 came out, and especially with 3, that's when all the AI scribes that were budding got sort of like disrupted in terms of what was going on, and we had to readily pivot to include transformer models. If your audience isn't familiar with, that's the key
Mhm.
innovation that happened here.
Okay.
The large language models, right?
Yeah.
Um, and at that point, our AI accuracy got extremely good as well and very timely. We didn't need our human scribes anymore.
Okay. So right now you don't use any human scribes at all.
No.
Okay. That's uh that's interesting. I mean, at the time, do you notice any difference? Because I imagine that you're bringing this concept to physicians, just doing some market research, getting the interest, right? So physicians were probably using Dragon, from Nuance, so now Microsoft, or all these different template generators like TextBlaze or Phrase Express or Dilado. So at that time, when you would go to speak to physicians just to see how they would gravitate towards a product like this compared to now, like how was that experience? Was it a lot of resistance? I mean, we still get resistance now, right? But how was that? Just trying to break in, talking to your colleagues and about the project you're working on.
Oh yeah. And that's why, as a physician, I was able to foresee and then also validate the concerns that my colleagues had about, privacy and security being the main thing, right?
Yeah.
We're ingesting audio data of doctor-patient dialogues, which, previously even just recording for a patient on their end on their phone was frowned upon, let alone, using that data to be ingested by AI to create notes. So there was a lot of trying to seek out early adopters who have a bit of a higher risk tolerance at the time, and we definitely found some. But it was like you said, it was really like the market validation piece, just trying to understand, given the economics of us having to have these human scribes, how we were going to like price this in a way that would also provide significant value and also get buy-in so that we can, convince the masses that this is a worthwhile endeavor. And then it flipped 180 within a span of a month once GPT came on. Like it was a really, really, dizzying experience to be part of that.
Yeah. So, I mean, how do you go from physician to a founder of, Mutual Health? So, if I understand correctly, Mutual Health is the parent company that created AutoScribe.
AutoScribe is the product. Yeah.
Okay.
Mu-
Okay.
Yeah, so the product AutoScribe was created in university like base, right? So
Yeah.
a collaboration between University of Toronto, Unity Health, which is St. Michael's Hospital in Toronto, and the Vector Institute. The three institutes came together to create it, and then licensed the technology to Mutuo Health, a new startup. So like it was a spin-off basically.
Yeah.
And yeah, so then Mutual Health went to commercialize AutoScribe and went to market. And yeah, the Mutual Health's goal was to really get the business model correct with the SaaS-based model, and we started with going to sort of like the what we call the consumer channel, where it's basically the mom and pop clinics not tied to large hospitals because
Yeah.
it was just easier to get adoption in those settings,
Yeah.
and it was solving primary care pain points, right? So that's how we started. But we really have grown significantly since then. And in particular, in the last little while, in November, Mutual Health was acquired by HealWell AI, which is the AI arm of Well Health. So I'm happy to talk about that journey as well.
Yeah, absolutely, absolutely. Because it's not every physician that this problem is faced by majority of of clinicians, right? Note taken, and but not all of them will dive into creating a product like this or trying to take a product like this to market, right? Maybe if you have some business acumen, some business history, then it's relatively easier uh, to be able to do that. So how, I mean, in terms of that experience, was there a point where you're like, maybe I should just focus on my practice, or because the value in what you were doing was you could see it very clearly and you saw the need that you said, I'm going to stick through it, just like every other entrepreneur goes through that cycle, right?
Yeah. Yeah, I definitely appreciate what my journey has been quite unique, as far as physicians are concerned. The way it happened was I've always viewed myself as a researcher and an academic scientist, clinician scientist, and very passionate about health informatics and AI, as it revolves around primary care, integrating into the primary care workflow. So that's sort of been my like wheelhouse. But once we felt confident that we had like a viable product, basically there was a either we were gonna you know use the academic channels to disseminate and open source the technology, or we were going to spin this off and into a industry based vehicle to get adoption. And because of the potential, just the speed of how things can be disseminated through private industry, we decided to go that route, even though I had no experience in business. So as part of that, I had to get training, and I'm grateful to the University of Toronto because I went through the UTEST program, which sponsored my entrepreneurship sort of instruction over a period of a summer, sort of an intensive boot camp kind of thing. Uh,
Right.
and so, I'm quite capable, so I picked up the skills quickly, and therefore put together the necessary components of an early stage startup
Yeah.
to get more grants and then get that flywheel of more resources, which means we can output more innovation and really start the execution on go to market. So that's how that happened. And we in the market we took a really specific track where we were really focused on optimizing the AI accuracy combined with the integration into existing workflows, including EMR integration, and then also compliance with all the regulations. So that's been our focus.
Yeah.
We've sort of been like less flashy than some of our competitors in terms of like digital marketing, but
Yeah.
we're sort of like the slow and steady wins the race kind of AI scribe, and we
Right.
are making a lot of reaching a lot of milestones, which I'm happy to talk about.
Absolutely. I'm very well, so much enthusiasm to get into that. Um, because we talk a lot about the positives that physicians get out of using a tool like yours, right? Whether it's them going home early or on time or not having to think about writing notes during the clinic. It's a long list. But conversations that are not being had enough, just from the top of your mind, is there anything you can say, what, this is great, but maybe it's security conversations or ethical data processing, but just for the everyday physician, are there any conversations, whether it's clinical or operational wise, how we implement a tool like this or integrate it into the workflows, like you said? Are they any conversations that you think that we should be talking more about rather than the hype?
Yeah, I mean, any clinician who's contemplating getting an AI scribe, like I strongly encourage them to do their due diligence in terms of all the, claimed advantages that one AI scribe has. And I strongly encourage them to try multiple vendors, right? And do direct comparison, see how it works, see if it aligns with their preferred, structure and preferences of how the tool operates and how it's can be implemented into their existing clinical operations, right? That's sort of like critical for any tool that is procured by a clinic and clinician. Um, I think what's more and more going to become an important conversation, and this is why our company has agreed to be acquired, is because we really want to be central to this conversation. Is it's not going to just be AI scribe. Like I use the term copilot, and maybe that's an overused term, but it's going to AI scribe is the first layer of AI automation of tasks. But with this new layer of other abilities that AI can enable, both on an administrative side, but also on a clinical, decision support side, uh, we as clinicians and health system stakeholders really have to start thinking about like where do we want to draw the line in terms of how much we want AI to encroach on our day-to-day activities.
Yeah.
Um, because like I don't at this point I'm not like trying to sugarcoat anything. Basically last week
Yeah.
Google published in Nature that they have superior doctors. Like I'm not. That's just basically what they're where what we're dealing with now.
Yes.
And it's like I think that's just like really aggressive in terms of thinking about like that's available and our patients going to start demanding that kind of tool. And I think that's we need a lot more thoughtful consideration, both at an individual level, but also at a system level, about how we're going to develop these things in collaboration with physicians and patients, but also um, where do we draw that line where
Yeah.
like agentic automation should be allowed, and what are the accountability lines, right? if
Yeah.
if I as a vendor am developing something that's making decisions, clinical decisions on their own,
Yeah.
is the vendor then responsible for the outcomes of those clinical decisions? Like I feel like it's not too early to have those conversations. It's
Yeah.
actually we have to be having these conversations right now.
Right now. I agree. I agree. And you just nailed it with because I had a similar conversation with one of the physicians out here in Montreal, Dr. Labos, is a cardiologist. And I asked him, similar question, what should we be talking more about? And he said the same thing that you said. Is AI going to replace the doctors, even if it's just agentic models? No, because there is one big question or one big aspect of it, which is liability. Who is accountable for that interaction at the end of the day, right? As a physician. So they, it's a matter of at what point should the physician, if you have a layer of an AI agent, managing the patient interaction, where does the physician come in? At the end, right? They need to make sure that they're the last stop to make sure this is exactly what happened and I'm comfortable with this and it reflects the conversation, right? So yeah, I think those are really interesting facts. And when you talk about having AI scribe as just one of the layers, and you want to go deeper, and then I start to think, okay, so if you're trying to go deeper and help physicians make better clinical decisions, then you probably need to have these tools really embedded in EMRs, right? Unless you're going to create your own EMR and so on. So you need them embedded or have these APIs that can pull data. So is that something that if you're able to talk about that you guys are looking at integration?
I mean, that's exactly the point, which I was sort of like teasing, is that that's why we've agreed to be acquired by HealWell, which is a well health company. And Well Health owns like 8 EMRs, including Oscar EMR,
Okay.
the is the main EMR of their company, but they have many other EMRs as well.
Yeah.
And the point being that being an AI scribe vendor external to that distribution channel is commendable, but it's difficult to realize that vision of safe and responsible and effective sort of AI co-pilot support, right?
Yeah.
But now we're inside the tent,
Yeah.
and we're not only just working with Well Health EMRs. We are now approved partners for primary care's other main vendors in English Canada, at least in across the country, namely Acuro QHR and TELUS. We're partners to PS Suite and Medisync in Quebec. So we are going to be realizing these co-pilot visions for all primary care across Canada. And what I'm the reason and that people always ask why are you called Mutuo is because I like when we founded the company, we realized, yeah, AI scribing, let's go for the low-hanging fruit of automating clinical notes. It's a
Right.
pain point, and it's a task that's very digestible for a prompted AI.
Yeah.
But that's like you just as I said, you just think of that as the first step in a broader AI enablement process. And so mutual means mutual in Italian, and it's basically the way I see this happening. Getting back to what I was saying earlier about all the
Yep.
collaboration with system stakeholders, is that there's going to be this continuous feedback loop between what the frontline practitioners need with patients, feeding back what they need from the AI models. The AI models improve. They operate for the clinicians feedback again, and it's this mutual feedback loops. And that's why we called the company, because there's just going to be this mutual feedback loop forever, basically.
Yes. Yes. So that's the best case scenario, right? Because in a way you're training your agent, right? As opposed to now where most conversations, I'm guessing for AutoScribe, you do not use the patient interaction to train your models, right?
So it's a really good question.
Yeah.
And so to your point, this is continuous, right? This is like nonstop. But again, we were created way back when like where the regulators were coming to consensus on was not clear. So basically, we have two versions of our product, AutoScribe Classic and AutoScribe Express.
Yeah.
AutoScribe Express doesn't use any data. It's anonymized, it's like no data ingestion. It's the out of the box model.
Mhm.
But AutoScribe Classic does use data, anonymized, de-identified data to train and fine-tune a personalized model for the individual clinician. That being said, in the last year, it's become clear regulators, at least in Canada, have decided they want to go a more cautious, conservative approach and are basically, largely not going to permit AutoScribe Classic, which is fine. I think it's reasonable to be cautious here. We were
Yeah.
just keeping both options available
Yeah.
until the regulators came to consensus on that.
Right. Okay. And going back to you were giving some advice to physicians when it comes to finding the right tool for them. So this is an area where I live in terms of part of what I do, right? So I don't know if you know, but I focus on workflow automation in clinics, right? So if I go into a clinic and I see that they have some gaps or some inefficiencies, I help them by just streamlining, optimizing, or bringing in tools that would solve the problem for them without disrupting their workflow. So workflow is very important to me. So when you say physicians, you need to try multiple and understand the tool that you're using and understand whatever regulations are there. We know that there's not a lot, but there are some best practices. I know the OMD, Ontario MD have released quite a few, and in Quebec here the CMQ, the Collège de Médecins, and quite a few, right? But what interests me is, from what you said, is that if a physician, so hypothetically, if a physician had, are you familiar with Capterra?
Mhm.
So if a physician had a Capterra type tool, and Capterra, for anyone who doesn't know, it's like this comparison tool where you can go to find any software or product that you're trying to use and compare. You can use that for your comparative analysis, basically. Um, but if a physician has some sort of a Captera-like tool where something very simple, they just answer a few questions about their workflow, right? Because we want to make sure that the implementation is very seamless for them. So a few questions about their workflow, which leads to maybe two, three products that would fit, and arguably the best products in the market based on the physician's workflow. And then they demo all three, and then they can go off to the races by choosing the one that works best for them. What do you think about something like that?
Oh yeah, I'm totally supportive of uh, the crazy thing about this current AI scribe market is that it is, I dare to use the word saturated, but it's like there's a huge amount of offerings out there, so it's quite overwhelming for an individual clinician to do their due diligence across all these options, right?
Yeah,
So for third parties that have the resources and the capabilities to scrutinize across the market offerings in a way that optimizes for that individual clinician's needs totally is a useful tool. You see that in many industries, right? That kind of best in class, those types of
yeah, yeah.
services are really, really useful when there are so many options on the market.
Okay, okay, that's interesting. Because one of the things that when I implement AI tools with physicians, I mean, the main conversations we usually have is accuracy, right? So how does a tool hallucinate a lot? Is it, just how are you managing hallucination biases and so on? But if we want to focus on accuracy, how do you guys, are you doing anything differently? So how can you assure the physicians in terms of accuracy? Obviously they have to try it, like you rightly said, but is there any strategy to addressing the accuracy conversation when it comes to AutoScribe?
Yeah, so we take both a sort of clinical as well as technical validation to the accuracy of our models. And so I'll come back to the hallucinations and bias point after that. But basically, at a clinical level, we have an internal mechanism where our human clinicians, including myself, use a sort of a validated scoring tool to score the AI's output in terms of key components of a well-constructed note. So the scoring tool that we use is a tool called QNote, and it breaks it down into like you know um, holistically capturing the key description of the narrative history, pertinent positives and negatives, capturing physical exam, et cetera, et cetera. So there's a whole list of things in that validated scoring tool that our clinician reviewers use. And we're continuously, doing in-house analysis to make sure that as both new sort of um, off-the-shelf large language models that we use, as well as any improvements to those models that we make through prompts or fine-tuning, the trajectory is always towards improved level of accuracy on that clinical scoring. Similarly, our AI engineers are using uh, sort of validated tools for ensuring that minimal editing is required per note. So we use tools like Rouge and Levenstein that show like numbers of edits, but also the amount of edit distance between the original AI note and how like the clinician's edited note. So we're able to calculate that over time as well per physician, but also across all our user bases, that the amount of edits are lessened based on the improvements that we make to the AI. So I said there's when you take those two together,
Yeah.
clinical and technical improvements, then are we feel like we're on the right track in terms of accuracy. In terms of hallucinations and biases, those are obviously critical and not just something that we on our own tackle. This is a industry-wide
Yeah.
challenge,
Hmm.
but we do implement for hallucinations embedded prompts that have guardrails to remove implausible outputs, as well as restricted outputs. So implausible is basically like, if a dialogue was lasting only 5 seconds,
Hmm.
we don't want any hallucinations that has a full note, right? It's impossible that a note would have a full SOAP if the dialogue only lasted 5 seconds. So we have restriction. We have a way of eliminating that kind of hallucination. Or restrictions is like, if something very sinister was verbalized, child pornography, I don't know, something very, very like
Yeah.
not acceptable. We have these built-in guardrails inside our prompts that eliminate those as well. Are they perfect? No. But and we include that in our user license when people use that we do our best, but it's not, we can't guarantee that it removes 100%. Um, but by and large, our user base has not complained about these issues, so we think they're quite effective for now. Um, and then biases is actually a real interesting one, and that's where that collaboration of that feedback loop I was telling you about earlier. Because
Yes.
right now, like, the off-the-shelf large language models are trained on the entire internet. Like, let's be honest, right? But
Hmm.
the entire internet has built-in biases, and we want to correct the imbalance in the data sets of that internet data set over time. So that to me is part of what I like advocate for using AutoScribe Classic, the one that does use our data, because we're able to label it as coming from sort of physicians and patients that are structurally marginalized and are not well represented in the baseline data.
Okay. So AutoScribe Classic, as you explained, it does adapt to the physician, right? It adapts to maybe their voice, their preferences, right? The formatting style, specialty. Can we say that? Like it adapts to their specialty as well?
Yes, with like a asterisk sort of caveat to that, which is we have currently our model is generalized, like our
Okay.
foundational model is generalized. But to your point, one of the changes to AutoScribe that we're going to make in the next year is actually switching out that generalized foundation model for per specialty foundation model.
Per specialty, right? Because do you find that physicians and the different specialty almost have different needs? Like you have to almost customize the tool per specialty, right?
Yes. So, and that, that's exactly like why we're investing in this. It is more complicated because we need a lot of clinical expertise to architect the prompts of our large language model for
Mhm.
all the specialties. So there's basically, we're not just investing in having different foundation models. So I don't know, let's say there's 50 specialties out there, right? We're going to have 50 different foundation models, which is doable. It's just you require quite a lot of resources for that. But
Mhm.
also we're going to need uh, clinical specialist consultants to validate
Mhm.
the output for each of those, which we do already, but it's our customers. They're doing it,
Okay.
on their generosity versus
Mhm.
when we change our foundation model, we really need them at that level of development.
Right. So wouldn't you say that um, in terms of customization at a specialty level, I think that's excellent, right? You're solving a lot of problems there. But if we go one step further, customization. I know you said you would have at the foundational level at least 50 different, ways to customize, but going to the individual physician level, regardless of the specialty, right? I think the customization needs to be able to go to that level. Because what I've noticed when I implement different tools with physicians is, or just clinicians in general, is that you can have two physicians in, or psychiatrists or gynecologists that would prefer to use two different tools entirely, right? And then so you scratch your head and you say, well, does this tool not work for all gynecologists, or what's missing? Because ultimately you're the same specialty, but again, we talked about workflow, so it comes down to workflow, and workflow is individual, right? So is that something that you're also looking from that lens, where it's like, okay, well, the foundational level should be broad enough to be able to customize, and then if we go one step up, which is specialty level, and then a step even further is just allow for the maximum customization level for each physician. Like, is that something you guys are thinking about?
Oh, yeah, absolutely. And so, just bringing the conversation back to AutoScribe Classic,
Yeah,
the reason we were having that option available and really trying to communicate the benefits of that option was exactly this point, was that we're gonna need large volumes of personalized data to get the feedback loop of the individual doctor's personal data to fine tune their own model. Like
yeah,
that's ultimately where we're headed. It was going to take time, and we made some improvements. Um, but now that the regulators are like, pumping the brakes on that way, we're taking it one level back at an abstraction level. And what I mean by that was actually, without revealing too much about our secret sauce,
sure.
we are using AI to describe the edits the doctor's making, so it doesn't include personal health information,
Mhm.
or any risk of that at all. Like
Yeah.
and that description data we can still use, right? Because it does not involve any concerns about what the regulators are concerned about. It's not perfect, but it certainly gets us part of the way there for that per user customization through learning from doctors' edits.
Okay. And so from the physician's feedback, what do you sense that they prefer the most, right? Is it just a matter of, hey, we want forms, we want templates? Um, can you just create me a template so that I can use this to uh, just capture what I want to capture and be done with it, right? Because that's not a loophole, but that's just another way to go about it, where yes, you can customize as much as you want, but for the physicians who are like, okay, I'm a neurologist, I see stroke, migraine, EMGs, and so on. I just want specific templates for my specific visits. Can you do that? So, is that a question? So, if a physician was asking you, can we use templates in AutoScribe? What would you say to that?
Oh yeah, that's and that we've had that since the beginning. Uh,
Okay,
Again, a very sort of like white glove approach. Basically, um, so you can, in our system, upload either, the skeleton of a template that you have in your EMR, with like the macros that need to be filled out, or you can upload an example of a typical note for, let's say, a condition like you said, like migraine or something. And our system, both through AI but also through our customer service staff human review, will ensure that the AI is then prompted to output into that format. So yeah, so basically you can do that, and then shows up on your template drop-down list, and then you can default and favorite those ones when you're doing an encounter.
right. Because ultimately, I find that to solve the biases, I mean, if you're able to give context, right? If you're able to give context prior to recording that conversation, as well as use templates, then it would really limit hallucination and room for biases. So that's what I discovered as I implement. It's like, okay, it's not that complicated. Let's just create a template depending on the tool. So it's good to know that AutoScribe can embed templates. So, physicians that want to try it, or, leave your link in the description. I'm not sponsored by Mutuo Health, but, my goal here is always to bring the tools that are, working and helping physicians to the forefront, so we can talk about it. And at some point, maybe we can reconnect and do some sort of a demo and actually talk about some of the features in depth. But I think it's important to, just bring the light on tools like yourself, especially when it's built by physicians, right? So if I'm a physician, I think you probably know what you're doing if you're going to build a not just some random person in their basement finding a way to make a quick buck, right? So in terms of value proposition, right? So if a physician's asking, great, there are over 100 different AI scribes out there. Why should I choose AutoScribe? And I don't know if I asked this. I don't think I asked this at the beginning of our conversation, but what makes you guys stand out? Just because I see, and I think I've mentioned this a few times, but my strategy with the physicians when I am implementing an AI tool with them is, spend an hour with them understanding their workflow, and then recommend the tools that fit, and then have them try it for like a month, and then they choose which one. So it's really, these are tools that have done my comparative analysis, right? So it's the best of the best. But when I do research on what tools are out there, there's so many, and I'm like, oh my god, like when can we like cap this at some point? So for a physician who has the time to go out there and not necessarily work with me, but find the tool themselves, and they're thinking, why should I use AutoScribe? What would you say to that?
Yeah, it's the most essential question I ask myself every day as a leader of a business, right?
Yeah.
The things that we're proud of in our mission
Yeah.
is sort of that continuous feedback loop to optimize our AI accuracy. So we're confident we have using the templates appropriately, that we have a really, accurate output. But beyond that, things that I think work in our favor is, you know, very extensive evidence of compliance with privacy and security regulations for all the provinces. We just became, for instance, one of the vendor of records for Ontario. After they did their vetting process, we're going through and nearly approved for the TGV in Quebec. Like these are things that like
Oh,
we take very, very seriously.
okay.
Um, and then, but beyond that, um, what I think, really sets us apart is for the price you pay, you get an EMR integrated, accurate version of the first generation of Copilot. We have a lot of like extra features that I'm happy to highlight, which is like
Yeah.
generating referral letters and patient handouts and in multiple languages simultaneously. So we have a lot of these like critical features,
Mhm.
but it's also what's on our roadmap. So we're launching what's called AutoForm, an alpha version of processing PDF documents, so that using AI Scribe and EMR notes, because we're integrated with EMRs, we
Yeah.
can generate the answers to those annoying questionnaires that we as doctors have to fill out all the time, right?
Yeah.
Uh, that's just one example of many of what we're currently layering on top of our AutoScribe, which really is going to be unique to what we can do in Canada, at least.
Okay. Yeah. No, I think that's that's interesting because you mentioned that you were acquired by HealWell, right? So now that's my question really about integration with EMR, because I see some EMRs are actually trying to build like a quick version, to within their ecosystem, right? So as a physician, if I hear that, I think I'd want that. I just continue to use my EMR that has the scribe within it, and that tells me that there's going to be these different layers that we talked about, just past scribe, but to other, allow me to make better clinical decisions. Does that suppose a threat to what you're doing where some of these EMRs are building these products? Yeah.
This question is actually like very it's insightful in that I think this is the crux of the question in terms of how the general digital health slash EMR market is going to go over the next few years
Yeah.
because um, up until the AI scribe, era, uh, the pain of migration from one EMR to another, like let's say you didn't like your EMR, but you wanted to switch to another one, it was a huge pain because the data fields wouldn't match, and you'd lose a
Yeah.
lot of your data, and everything would be in PDF, and you wouldn't be able, like it was just too much of a pain. But now, uh, like EMRs that don't, embed and integrate AI scribe slash copilots natively into their tooling, um, people like doctors are gonna accept that pain to go to a vendor that does have that, right? So,
Yeah.
so in terms of your question, the first part of your question is, I really do think those EMRs that, deprioritize this integration are going to fall by the wayside. Um, so that will sort of, remove some of the competition in the EMR market at that level. But then to your point about, okay, now if it's just apples to apples, are we, EMRs that have that integration of an AI tool, central to their strategy going forward, how do you compete at that level?
Yeah.
Well, my argument on that is like to bringing back to what you're saying earlier, having a physician direct how that's going to occur. I'm very proud about being a physician because I understand the clinical needs,
Yeah.
not just the administrative needs. An AI engineer can automate some of the administrative tasks like note taking and filling a prescription, whatever, but really understanding how to integrate, guideline-based evidence, um, analysis of a patient's previous record historically and how that impacts decision making going like in real time in terms of nudging and suggestions that happen as at a co-pilot level. Really, you need a deep clinical thought about how that gets staged and surfaced at that point. So that's exactly what we're building right now without revealing too
Okay.
much. So it's
Okay.
very exciting. Like
Yeah.
you can imagine
Yeah.
being at HealWell right now, thinking about all these
Yeah.
things that come together.
Yeah.
But yeah, that's our bet. That's on us, being the ones that of the EMRs that have AI scribes integrated. Clinicians will sort of start to prefer the ones that have that clinician thought leadership at the forefront.
Right. Because when you say, I mean, that's also good to know that that's really the direction that you're taking. I know we talked about it at a broader level, but this is getting deep into it. When you think of the EMRs that are integrating, they use this, if it's API tools, communication with bidirectional or maybe just uni with the AI scribes, or they're built in natively. That's the difference maker, right? But again, it's like I said, if I think at the end of the day, if you build something that really provides that value that stands out, you don't need to worry about anything, right? You don't need to worry about this type of competition because the clinicians will see the value and they will gravitate towards what you're building, right? Otherwise, why be in the game, entrepreneurship? Anyway,
Exactly. And it's
um,
cool, right? Like
yeah,
ultimately it's all about uh, providing the most optimal patient quality care, right? And
right.
like as a physician, I'm so excited to be able to help design how that will enable individual clinicians to do that.
Right. Are you going to go one step further in terms of, just administrative? Are you going to be solving any administrative issues, like for the front desk, right? So I see a lot of tools out there that are doing call center. right? So you call the clinic, a patient calls the clinic, and the AI answers. And if the tool is integrated with the EMR, then it would just book that appointment. Typically for a GP or maybe some private clinics that allow for that with specialty specialists. That's tough, right? I've gone through that nightmare. I don't think we're there yet. But are you also looking to get into that area, or maybe you're not able to talk about?
Well, certainly within the broader well ecosystem, there are business units that are focused on that particular challenge.
Okay.
Us at Mutuo, we're really focused on the point of care.
Hmm.
I think you mentioned in your preamble before our call, for instance, pre-visit intake. For sure, we're going to be ingesting that as part of our AI scribe. That will be available within the next few months.
Okay. Interesting. I mean, that's right. I was going to ask about that because we're not trying to replace nurses here. That's it's not going to happen. But if a nurse takes 5 minutes, 10 minutes to triage a patient, if you're reducing that 10 minutes to maybe 2 minutes, and you're able to see more patients. I mean, if that's the goal, right? If you're able to allow the nurse to see more patients, or maybe the nurse to spend more time with the patient asking, just, I don't know. I think that there's some value to having the nurses send these pre-visit questionnaires to patients, have them fill it out prior to them coming in. So if that's what you're planning to have, right? An agent, like a nurse agent, AI nurse agent that would pre-fill this, and you can customize it from the clinic side of things.
Exactly. Yeah.
Okay.
And we have already collaborations with two vendors in particular who already do digital questionnaires, and we're just going to be enhancing that and integrating it directly into our AI scribe pipeline. So that's what we're actually building that right now.
Okay. Okay. And so in terms of onboarding, so I encountered something interesting with you too, which is unlike any other tool, whereas I want to try the product, put in my email, whatever, my name, specialty, and so on. I can just sign up really quickly and I'm off to the races. What I notice is that it's like you apply to get an account, and you get your credentials within 24 hours, or 48, but under 48 hours. And you get these tokens, these security codes. So it's part of your 2FA authentication process, right? So I've demoed more than 20 different scribes, and none of them approach onboarding that way. So why did you guys approach it that way in terms of onboarding or signing up for the tool?
And this comes back to the privacy and security piece that I mentioned that is like really central to our ethos. But both from ensuring this is a real customer account, we're not being spammed, we really, try to ensure that we're not getting people inside the application who will try to do our application harm, you
Yeah.
know. Plus, we turn on this two-factor authentication by default, so that again, it's another layer of security. We
Yeah.
can, per client, they can ask us to turn off the two-factor authentication at their own risk.
Yeah.
We have that conversation, but yeah, and that is certainly like, it is a go-to-market strategy that has its pros and cons. And to your
Of
point,
course.
like the pro being for more cautious doctors, they like it. They think that we're being due diligent and
Yeah.
responsible in this very disruptive era of AI into healthcare.
Yeah.
But at the same time, doctors are very time pressed. When they press sign up, they want to try right then and there because they don't have any other time.
Yeah.
So we'll probably lose some clients by doing that. But there's room for in the market for people who are taking different strategies like that, I think.
Right. Yeah. No, it's like I said, it was just interesting to see that that was your approach, and we're not desperate to get you to sign up. If you want to sign up and really use our tool, you're gonna have to wait because we take our time and we focus a lot on security. Is the message that I got. And then there was a inner voice where I'm like, but they're probably losing a lot of clients because physicians want to try this right away, like you said as well, right? So yeah, no, I think it just sends a message to the physicians that it's not about just making a quick buck. It's security is important. So are you guys almost close to the like completing the TGV? Because the TGV that's also bringing some validation to the Quebec audience that okay, this is another tool that is certified by the MSSS, and it increases the competition because there's a few that are maybe two, but I think it would give physicians a lot of just knowing that a tool like yours is certified. So my question is really, is that something that they can expect in the next couple of weeks or months, or how
Yeah,
long do we?
I'm hoping so. It's we're under audit
Okay.
by the TGV auditors now, and so as I said, we have a lot of documentation that other AI vendors don't have at the outset. Like we're SOC 2 certified, and we have multiple PIAs and TRAs and et cetera, et cetera. So we have a lot of documentation, which I hope will streamline the auditor's work.
Yeah.
So, it's our first time working with Quebec, and Quebec is obviously very unique in terms of some of the due diligence they do. So,
Yeah.
I'm not counting my chickens before they hatch, but I'm
Okay.
hopeful before the end of May,
Mhm.
the auditors will have reviewed and signed off on that.
Okay. So another big, well, I talk about this with every every founder or CEO of an AI tool, which is the workflow, the onboarding workflow, or just the usage of the tool requires consent, right? Whether you train your models with the interaction or the conversation or not, it's I recommend to all of my clients to get consent, which that's no secret. Everyone should get consent from the patients. But if you're using a tool like AutoScribe, for example, and I'm not, this is hypothetical, that is not, integrated with the EMR that you're using, right? And so you would require the front desk, a physician that's already busy. They're trying to alleviate that stress. So they're not going to ask those questions to the patients when they walk in. So I'm using this tool. Do you want to sign this consent? It takes about 3 to 5 minutes to get the patients to sign that. As time goes by, the time goes down, obviously. But you have your front desk, your receptionist, asking these questions or getting the patients to sign the consent form. That time that the patient spend with the secretary, obviously could be spent somewhere. So we're taking a little bit of time from the physician and adding it to the secretaries in a way. Again, dependent on how integrated you are with the EMR or how advanced your EMR is, where there's some EMRs that you can just send consent forms electronically and they sign, and this is not even a conversation. But most of them don't, right? And you have to ask in the front. Is that a problem that you see AutoScribe solving anytime soon? Where it's like, you know what, let's help the EMRs or streamline this process.
Oh, absolutely. We've thought deeply about this. We view it as a change management
Hmm.
question. Um, and we actually are doing studies on this because it's so critical to thinking about how feasible the use of this tool is in real world clinical workflow. Um, there's a few dimensions to this, as time goes on, the consensus among health system stakeholders on this has changed actually. Uh, First of all, for sure at our application level, uh, what we've built in natively is after in AutoScribe Classic, after a user clicks the record button, there's a pop-up that says, "Do you have verbal consent to use AutoScribe? Yes, no." And when the doctor clicks yes, that's tracked in our database. And if they want, it could even add it to the medical note in the SOAP note at the bottom. Consent to use AutoScribe has been obtained. Whatever, something
Mhm.
like that. Um, and so that is an option that makes it very, very like minimal effort to do the required acquiring of consent, and just using our application for that. That being said, the AI scribe is new to the market. There was never been like, a case law where someone sued someone about this and whether the
Mhm.
appropriate,
Yeah.
mechanism of consent has been, used, etc. So, what we have right now is key stakeholder groups' opinion on how to approach this. So I would point your audience to the CMPA has direction, the different regulator bodies of provinces. I think you said the CMQ in Quebec, but
Yep.
CPSO here in Ontario. They all have clear direction on how to approach this. And what I would recommend, um, the most sort of up-to-date best practice toolkit that I've seen for Canada is Ontario MD's patient consent toolkit for AI scribes. Maybe we could put that in the link,
Yep.
in the show notes as well, just
Yep.
because um, they have a very comprehensive toolkit about like all the legal reviews and opinions about how this should be done in an appropriate way. And to that point, like there is consensus even at this point, just that without like getting individual patient's signature, if you put a poster in your waiting room and if you send out in a newsletter like that this tool is being used, and then you just put it in the medical note that's sufficient. And that removes all that barrier of a secretary at the front having to do that obtaining of the consent, or the physician at the beginning of the appointment doing the consent. So yeah, I strongly recommend anybody who's looking at getting an AI scribe and worried about the consent process to review Ontario MD's toolkit.
Okay. Yeah, no, definitely add it to the show notes because it's like we both said, it's essential to be able to, you know, address that. Some physicians say, no, I'll get verbal consent, and I'm never comfortable with that. I give them my recommendations, and obviously they can do whatever they want, but I always ensure that I steer them in the right direction. And so, if a physician comes to you and say, "What's I want to be able to use AutoScribe," right? What advice would you give me? How should I go about it? You know,
Yeah.
that would um, reduce the chances of me dropping this in the next couple of weeks and so on, because there's an aspect of habit change, and if that onboarding process is not seamless, forget about it. Like, I'm sure you can attest to that.
Yeah, absolutely. And you know, when we begin our interaction with a new client, we make it very clear to them, like, think of this as a journey of initiating a change management. You need to have a bit of the time and space to make sure that the way you're trialing the tool the way it's supposed to be trialed and embedding it in your workflow in a way that it is feasible. So it's not like just like you won't know just from playing around the tool for like 20 minutes
Yeah.
whether this is the right tool for you. You really need to be thoughtful in your personal evaluation of it, but also the clinic's overall evaluation of it in the clinic's workflow. So we give guidelines on things to consider when they first start, both at the application user level, but also at the clinic change management level. And we highlight some things to consider. Um, and that, and we make it broad enough so that we don't say try other AI scribe vendors, but
Of
we know
course. Yeah.
smart enough to do that. So generally speaking, so like that, positions us in a way that we're trying to be, honest and have our integrity throughout this process. And one of the things that I would really want to highlight about AutoScribe and Mutuo is that we have, like, as I said, that white glove service of human support. So like, you can speak to us on chat, you could speak to us on the video chat, you could speak to us um, with screen shares. Depending on where you are in the country, we can actually go in person sometimes. So we can really help answer those unique questions for new customers to make sure that they're set up for success.
Okay. So another question that I have just on that onboarding and adoption conversation is, why do you think, for the physicians that don't end up fully adopting tools like this in their practice, maybe they try it out and they stop at some point, because I'm sure that you've probably come across that, or maybe some of your colleagues or whatever. Why do you think that is, where there's not always like a full adoption to the technology, regardless of the tool, so I've seen a few studies where physicians would say it didn't really match with how they work, so workflow conversation, or they didn't have the right devices, or they had to move from one room to another if they're in an emergency. And so it's not like a well thought out process, like you just said, because there is that misconception um, that physicians have, or the AI scribe suppliers let the physicians know that it's a 10-minute or 20-minute onboarding process. I'm like, no. The reason why I'm also part, um, being an AI scribe consultant, if you could put it that way, is that I know that it's not right. So putting that aside, just from your experience, why do you think that the physicians stop adopting AI scribe after a while? Which it's really a minimal amount, but just want to be able to address that. Yeah.
Yeah, I mean, there's a bunch of reasons.
Mhm.
I can go through a whole list. I'll just
Okay.
highlight, highlight two that I think we hear a lot on our end. One is the, there's this whole concern among clinicians about having multiple tools, right? Like, a lot of physicians want everything inside their EMR, so they're in one tool and it's like one click to use, and they don't because they don't have the cognitive bandwidth to like consider signing into a different platform or switching tabs or whatever it is. There is a certain cadre of clinicians who, even though when they do it, they get value out of it, just that intermediary step is interruptive of their workflow,
Mhm.
and they just can't get into the habit of overcoming that. I
Yeah.
think that's one piece, and that's why for us it's been so critical for us to get into EMRs so that we remove that barrier. Uh, but second of all, and this one we're still trying to think about, like, what to do. And I'd be interested to hear your opinion, uh, which is it's really like when people try AI Scribe, including AutoScribe, I would say like two-thirds or three-quarters, like it's super clear, like you know, AI gets them the generated note gets them 90% of the way there, and they don't have to like worry about writing the note throughout the visit and
Mhm.
editing the note at home and the pajama time and all that. Like it's very, very clear.
Mhm.
But there's about a third or maybe a quarter to a third of clinicians who try it, still see that value, but for them, the amount of effort, cognitive effort to edit a note is a lot more than writing a note from scratch. For some reason, like reading line by line and seeing where an error is, and then like
Yeah.
putting a cursor and like back spacing to get rid
Mhm.
of whatever it is, like that work for those individual clinicians is onerous. And like until we get very, very tight in terms of like matching the exact output that doctor expects, I don't think AI scribe is going to work for that sort of
Mm,
cohort of doctors. That's I mean, this is
yeah,
what we've seen with our customer base at least.
yeah. I think it's broad. It's right across the board. But what I can say, which is something I think we've literally been singing it the whole time, is templates. Right. And which you also just said that, but the templates will be the game changer, is the game changer for that, So the physician needs to know which tool they're getting into, right? So you need to know that this tool can do templates to this level or can integrate forms to this level. So if you're using a tool that has templates, start by creating your templates, testing it, making sure that they work before your first visit, you know
Yeah.
and that's what I always say. You have to try that first, otherwise forget it. You're gonna call me and say, hey, this tool that you gave me was terrible. So they hate on the tool that they're using just because the steps that it took to implementing it were just wrong. So if you're a physician and you can focus on your templates or macros, right? So I'm not sure if AutoScribe has macros or these shortcuts where you can put short text and it generates notes, or just voice macros where you say this the exam is normal and it populates a normal exam for that type of visit.
We don't have it yet, but it's on our roadmap for this year. Yeah.
Amazing, amazing. Yeah, so things like that, I think, I've seen them in action, and I see that physicians do appreciate that. But we have to educate the physicians that it's not a 10-minute onboarding process. It really isn't. You really need to spend time doing this. Even if you're a very tech savvy physician, like you still need to do it. You need to go through the process of creating your templates, and so that's been my experience. Templates really is very key to um, a quicker adoption with clinicians, and I think it's highly underrated amongst the suppliers. So I know that a lot of tools are coming up with that. But hopefully, AutoScribe can have that fully. Well, you have templates, but macros and all of that fully integrated, so that when a physician signs up for your tool, it's like, no, just the same way you stop them from rushing to use the tool. That's create your templates first. This is gonna help you, because you know that otherwise you're wasting their time, they're wasting yours, they're not gonna end up using your tool. So it's like your part of your onboarding process is create your templates before, or at least one before trying it out. you know
100%. Yeah,
yeah.
totally.
Yeah, so I don't know if any other tools out there. We're not here to talk about other tools, but I think that would be an interesting workflow for the physicians to adopt. And you had mentioned the acquisition, right? So we were talking about the transition from you being a physician to running Mutuo Health and then taking AutoScribe to the market, and going to taking the program at, like, the entrepreneurship program at U of T, right? And then getting to a point where you get to sell that to, or whatever the deal was, to Well Health, or HealWell. So what was that like for you? Because that was like your baby, right?
Yeah.
And letting go of part of it or all of it, it's I'm sure that no one, maybe you want to get to that point as an entrepreneur, but at the same time, it's a tough one.
Yeah, of course. First of all, like, I still feel a little bit humble about being an entrepreneur because, again, my innate disposition is to being an academic researcher. So that's still my sort of my core self-identity is that.
Yeah.
Um, but with that being said, I think when GPT came out, it was like so revolutionary. It was very exciting, right? You can imagine just like the AI accuracy just became like unfathomable. Um, But as soon as that happened, we also recognized this was going to go from a zero like competitor market to a saturated market very, very fast with the
Yeah.
commoditization of what's available.
Mhm.
Thankfully, we were ahead of the curve. We were, already had some traction. Privacy and security of our application was in place, etc.
Mhm.
Uh, but why I got into this in the first place was never to make like a gazillion dollars. This was not my
Mhm.
motive. The main motive me and my team had was to have a real impact on healthcare, right? Um, and so when we got, we were getting traction, and the way like EMR vendors think about, acquisitions is they have to like have, proven product market fit in a way that aligns with their mission and values.
Sure.
And we had developed relationships with multiple vendors. I mean, it wasn't just Well Health. We had contact with a bunch of them. And I always thought it made sense, whether it was early or late, that we would, get into one of those ecosystems to build that deeper native EMR
Mhm.
co-pilot tooling that I mentioned earlier.
Mhm.
And thankfully, Well Health, about a year ago, really exactly a year ago now, in
Yeah.
2024, springtime, they came to us being like, you know what, we're not going to build this in-house. We're gonna acquire an external company to integrate into our tech stack and then build thereafter. So they told me they interviewed a bunch of scribe vendors, and when they interviewed us, like, because exactly what I was just been communicating with you this whole call is what I told them at the time about what our vision is at Mutuo, and they're like, yeah, that's exactly what we want to do. And so they made us an offer, and I was like, okay, I can take this offer, or I can't. And we decided to take it because uh, just being an external AI scribe vendor and trying to differentiate yourself from the like very saturated competition was going to be increasingly difficult.
Mhm.
And we recognize that. Like, so how else can we get to that ultimate vision of
Mhm.
AI assisted care that really benefits patients is, getting inside the tent with a vendor.
Right. Good stuff. I mean, I know that we're coming close to a time here. Um, but just in terms of, entrepreneurship and problem solving, how would you say, if you're able to answer that, but how would you say being an entrepreneur has changed the way, if it really has? And I know that you say you're a researcher scientist at heart, but do you think that entrepreneurship has changed your way of your problem solving skills at all?
For sure. Um, it's uh, made me very focused on like quick and but yet well considered decision making
Yeah.
compared to research. It's like the opposite. It's like you got to like go to the depths of detail in understanding a problem and coming
Mhm.
up with a solution.
Mhm.
And you should take as much time as you need,
Mhm.
because otherwise, your peer reviewers will just, scrutinize you if you miss something.
Mhm.
Versus in markets, markets don't wait. You gotta go a lot with um, you know data and analysis of that data, but also with gut instinct
Mhm.
when you're making decisions. And that is not something that comes innately for me. But with the mentors that have been along with me in this journey, I've developed that instinct.
Yeah.
And so, there's one thing that like I there's so many coulda, woulda, shouldas, but there's one that I really think about
Yeah.
that I has been a really teaching lesson, and that's the main thing about entrepreneurship is it's important to fail
Yeah.
because you learn from failures, right?
Yeah.
And one of the things that we were so focused on privacy, security, AI accuracy, embedding in EMRs and workflows
Mhm.
that we deprioritized user design and user interface. And so some of our competitors like really, really focused on that and have gotten huge market share because that was the first thing they focused on after GPT came out. Um,
Right.
so, anyways, I've learned enormously from that. That human computer interface is primordial once the AI is at a certain level of accuracy.
Okay.
And there's going to be many other moments like that coming up in my life where I
Yeah.
hope my instinct will be more accurate.
No, I hear you. I hear you. I mean, so if I had to ask, like, do you have do you have top three mindsets, to have, or habits, or yeah, like top three habits or mindsets to have when it comes to problem solving at the level that you do, in terms of being an entrepreneur, right? So what would you say that these are these habits or the mindset that you have to have to be able to bring a product like you just did to the market, especially being a physician that is already busy, right? So yeah, so do you have any top two or three habits or mindsets that people should have if they're looking at something like this?
Yeah, I mean, it's this is not for the faint of heart, even for physicians. Like
Yeah.
I took the plunge at the encouragement of my mentors,
Mhm.
but there were a lot of challenges. Like
Mhm.
both personal but also financial and
Yep.
like legal. Like when you sign up for this journey, it's both exhilarating but also very daunting. You're signing up for
Mhm.
quite a journey.
Yeah.
But in terms of the habits that are very important to hone and cultivate throughout that whole journey, first of all, like competency, like and doctors are type A in general, but like
Mhm.
if you're too busy to learn the skills to be an effective, executive, don't do it because you'll flail, right?
Yeah.
The confidence comes from being, competent in the ability to work.
Yeah.
But beyond competency, um, I always think it's really important to have a channel with someone who has been through the entrepreneurship journey for you to vent to,
Yeah.
because and they don't have to be in-house to the business. They could be external, but
Yeah.
someone who can relate to the journey you're going through, because
Yeah.
there's so much emotions associated with it that if you let those emotions sit and fester without like speaking or venting with someone, then they actually can impact how you
Yeah.
behave with your colleagues and your staff, and you're trying to
Right.
build a positive workplace environment, and you don't want to bring the stress that you might be experiencing to all those dialogues.
Yeah.
And finally, just like always remind yourself of why you signed up for this in the first place. For me, as I mentioned earlier, it's to benefit patient care.
Yeah.
um, and for me, I'm convinced that through industry that's the biggest way I can have that impact. But
Mhm.
for other people, it might be making money. It could be
Yeah.
transforming their own little specialty rather than all of healthcare. Like they have to find whatever gets
Mhm.
their inspiration juices going.
Okay. Yeah, you need to have a strong why, right?
Exactly.
I do the same. I have a small team of project managers, and but every day I see being undercut by what the EMRs are doing and so on. So, you always have to. It's like you said, being able to make quick, highly decisive decisions and effective. But ultimately, the most underrated statement is fail as fast as you can, right? Everyone says it, we all say it, but I don't think we're saying it enough, you know.
Yeah.
But thank you so much for joining me today. This was awesome. I think I'd probably reach out to you towards the end of the year just to set up another one so we could just see where you guys are. And I'm guessing for people looking for you, I'm going to leave your LinkedIn and your AutoScribe site and the show notes. Is there anything else you want me to leave for our listeners?
Yeah, thanks so much, Yuzel. It's been a real pleasure joining you today. Yeah, so mutualhealth.com is our website. Follow us on social media. We have pages on Facebook, Instagram, and LinkedIn. You can email me at noah.crampton@mutualhealth.com. Yeah, I love to chat just about these issues with anybody.